Good morning, everyone. Welcome to the March 28th, 2022 Inservices. Today, Jackie is going to talk about CHS, which also stands for Cannabinoid Hyperemesis Syndrome. Please make sure that I will mute myself as well, but please make sure you mute yourself, and I'm going to turn it over to you, Jackie. It's all you.
My screen. Oh, hello, everybody. Like Dr. Baldwin had just said, my name is Jacqueline Brispin, and I'm a fourth-year pharmacy student at Campbell University. And today I'm going to be talking to you about cannabinoid hyperemesis syndrome. So what I want you to get out of this presentation today is just understanding what cannabinoid hyperemesis syndrome is, recognizing the symptoms of cannabinoid hyperemesis syndrome, and then recalling some treatment options for cannabinoid hyperemesis syndrome. So what is cannabinoid hyperemesis syndrome? So it's a condition that leads to repeated and severe vomiting. It is rare and occurs in daily long-term users of marijuana, but it can also occur in users of CBD products. So just to break down the word, because it's a big word and can be a little bit confusing. So cannabinoid is going to be that chemical substance. So cannabis, marijuana, or weed. And then hyperemesis just means extreme persistent nausea and vomiting. So cannabinoid hyperemesis syndrome is also called CHS, so you may see that throughout this presentation, but that's just what that stands for. So marijuana has several active substances, and this can include THC and other related chemicals, and these are usually what gives you that high and other effects that users may feel. And we know that marijuana is the most widely used illegal drug in the United States. It's most commonly seen in young adults, but people of all ages use marijuana, so this is why this topic is important today. So CHS can often occur in people who regularly use marijuana for several years, but it can also occur from people who start to use CBD products too. So what causes CHS to occur? It's kind of unknown. Scientists are still trying to figure out exactly how it's occurring, because when we think about marijuana and its uses before, everyone's always told that it can be used to help prevent nausea and vomiting, especially in patients who are undergoing chemotherapy treatments. But there's something about the chemical substance and structure of marijuana and CBD. When it binds in our digestive tracts, it sends signals up to our brains saying, get this substance out of my body. And that's what causes this hyperemesis syndrome. So the persistent vomiting and nausea. So we're seeing more of this in hospital systems and outpatient clinics. So we're just wondering, why is this use kind of increased? And some research has shown that cannabis users since COVID-19 began, so right at the pandemic, have increased their use of cannabis products on an average of 91%. So that's a big increase in these products. So, and then we know the pandemic has been stressful and a lot on all people. So people kind of turn to our natural products such as marijuana and those CBD products to just help with their disease states. So if they have anxiety or depression or glaucoma, chronic pain, people have been turning more to these products to see if they've been beneficial or helpful, because during the pandemic, it was kind of hard for some patients to go see their doctors or get their providers to send them prescriptions. So a lot of people just turn to these natural products. So now we're going to kind of get into the symptoms of cannabinoid hyperemesis syndrome, and it's broken down into 3 phases, which is described in this picture. So you have the prodromal phase, the hyperemetic phase, and then the recovery stage. So now we're going to just kind of break these down. So we have the prodromal phase, and this is when the main symptoms are early, and it's early morning nausea. You might have that abdominal or belly pain. Most people can continue to eat normally and do what they normally do throughout the day, eat, drink, but some people actually turn to use marijuana more because they've been told that it can help with nausea. So they may smoke more marijuana or eat more marijuana or use more CBD products. But the more we use, the more it's in our system, which is going to make our vomiting and severe nausea worse. So then we go into a hyperemetic phase, and this is when the vomiting is intense and overwhelming. And in some patients, it can be so severe to the point where it causes people to scream, and this is called scromiting. So it's screaming and vomiting together. So some other symptoms can include ongoing nausea, repeated episodes of nausea, increased belly pain, decreased food intake and weight loss, and then symptoms of fluid loss. So dehydration, because we're not able to take in any food or any water, so we become dehydrated. Most people at this stage will try to take a hot shower to ease their nausea, but this phase can continue until the patient or person stops using marijuana or CBD products completely. And then the recovery phase, this is usually when your symptoms go away, but they will often come back if you try to use that product again. And then during our recovery phase, this is when our normal eating and drinking is possible again. So we don't have to have different ways to rehydrate you. So when we think about cannabinoid hyperemesis syndrome, as a pharmacist and doctors, we always think about how do we diagnose this? So it's kind of a diagnosis of exclusion. So we have to really figure out what's been going on. So your doctor will discuss your symptoms, the common questions. When did this happen? What were you doing when this happened? How long has it been going on? They're going to take all that history from you. They're going to figure out your past medical history. So do you have diabetes? Do you have AFib? Do you have heart disease, hypertension? They're going to try to get all of the information possible. What medications do you take? Did you take any of these medications before these symptoms came on? Just to make sure that we're treating the right things. And then they're going to take blood tests and all different tests. So they'll do blood tests, the electrolytes. They'll look at pancreatic and liver enzymes just to make sure everything's okay. They'll do urine tests just to make sure there's no like infection that might be going on, like urinary tract infection, drug screen, and that'll really be able to tell if it is cannabinoid hyperemesis syndrome, because that'll test for the chemical substances in marijuana. And then they'll do x-rays. Sometimes they'll do head CTs and abdominal CTs if they're more concerned, but sometimes they might just stop at the drug screen and go from there, depending on the symptoms. So treatment of cannabinoid hyperemesis syndrome, usually the symptoms will ease off in about a day or two unless you continue to use marijuana. And in order to really fully get better and stop this from happening, you have to just stop marijuana and CBD products altogether. But if you have such severe nausea and vomiting and you do go to the hospital to get checked out because you're not really sure what's going on and you have to stay for a short amount of time, during these hospital stays, they may give you treatments. So this can include IV fluid replacement for dehydration. So since you can't get any water in through your mouth, they're going to have to give it to you a different way so we don't get dehydrated. They can use medications to help decrease the vomiting and nausea. They can use pain medications because sometimes people with getting sick so often, it can make your stomach hurt and cause pain in your stomach.
This is Heather Arcuri, and I had a quick question for you. My husband is going to be changing jobs in a couple of weeks, so we'll have different insurance. So I was wondering if you could tell me how much I have left on my current benefits, because
Sorry. Then there's also proton pump inhibitors. So these medications can be used to treat stomach inflammation. And then frequent hot showers, which we talked about earlier, that can also help with easing the severe nausea and vomiting that people can have. Some people will need prescribed medications to help them calm down if they're feeling anxious with getting sick so often. So those are your benzodiazepines. And then in a small sample of people, rubbing capsaicin cream on the stomach can help decrease that pain and nausea. And it does have the same effect as a hot shower. So some people can't stand in the shower for too long. So this is a great way to have that hot shower just in a different way. So just a refresher on capsaicin cream and kind of how to use it. So with this cream, you want to make sure you wash your hands before and after use. And for cannabinoid hyperemesis syndrome, the place you're going to want to put it is on your stomach. So you're just going to put a thin layer on the stomach and rub it in gently. After using it, you want to make sure that you don't bathe, shower, or swim. You want to make sure you don't put the cream on right after a shower or bath. And if the cream gets in your eye, like if you forget to wash your hands after, just make sure you rinse it with cool water, not warm water. So when we think of cannabinoid hyperemesis syndrome, we also have to think of possible complications. So after severe prolonged vomiting, it can lead to dehydration, like we've talked about. So you're not getting any nutrition in through your diet. So this can lead to electrolyte problems in your blood. And Some things that we know from dehydration that can have complications are muscle spasms. It can cause seizures, kidney failure. You can have heart rhythm abnormalities. You might go into shock, and rarely you can have some brain swelling. So it can be serious. So we want to make sure that if this is happening, we get it treated quickly. So the prevention of cannabinoid hyperemesis syndrome, the main prevention is not using any products. So no marijuana, no CBD products. You have to stop it altogether, because if you start again, the vomiting will return. And it can take a few years to develop, so you may not notice it at first. So if you're using these products for a year and you don't notice it, but then it comes out of nowhere, that's not uncommon. But the main thing to know is once you have cannabinoid hyperemesis syndrome, you can't use these products again, or you will go back into this vomiting syndrome. So I just wanted to do a little refresher for CBD products, because there's a lot of different doses and there's a lot of different products. So there's lower doses and there's ultra high doses. It just depends on the amount of milligrams that are in the product. So you can have a low dose with 5 milligrams, and then there's products out there that have 60 plus milligrams. But the main thing to know is that the amount that you use is supposed to be based on your weight, the condition you're treating it for. So if your anxiety, depression, things like that, they all have different doses, and the dose may be different from one person to another. So one person may be fine on 5 milligrams, but another person might need 30 for the same exact reason. So if you have anxiety and your friend's using 5 and you're using 30, if your friend starts to use 30, that might be way too much for them. So that can cause that upset stomach, nausea, and diarrhea. But it can also cause CHS if we use it too much or too frequently. And then some people, they might be fine with using 5 milligrams, but since everyone is a little bit impatient at times and we just want that quick response and that quick relief, if we use too much of a high dose, it can cause CHS. So the main thing to know from this presentation is when to call your doctor, what should you do? So if you're having this cyclic vomiting that won't stop and you're feeling dehydrated, you're feeling sick, you're gonna wanna call your doctor, or if it's been a day or more. Some people will come, I know I experienced it while on one of my rotations at a hospital. They had smoked, were sick for like 5 hours, could not handle it. So they just came straight to the hospital, which is normal. So if you are feeling that way, go get checked out or call a doctor just to make sure that everything's okay. And then if you do have any questions about cannabinoid hyperemesis syndrome after this presentation, you can always contact Dr. Baldwin at Resources for Seniors, and then her number is there, and it is also on the handout that you were provided. And these are just some of the references that I used for this presentation. So that's pretty much it for cannabinoid hyperemesis syndrome, and I'd be happy to answer any questions that any of you have at this time.
Excellent. I imagine that some of you might have questions. If you cannot ask them because you are muted, feel free to type them in chat, and we will be happy to answer them. However, you have a couple that are sitting here.
Hi, a couple questions. This will be obviously not when you weren't even born, but is this something that happened back in the 70s when free love and marijuana and everything like that? Because I'm curious, I never heard anything about the vomiting and all of that stuff. Or is this something that's relatively new? And is there a difference between straight marijuana and CBD products, because they were not anything that was out, years ago? Is this something relatively new, and is it a combination of or just separate marijuana or CBD?
Yeah, so I don't really know if it was around in the 70s. I can't really speak to that. From my research, it didn't really say anything specific of when it started or when we noticed it. So I don't know if Dr. Baldwin knows anything about that, but I do know with, it's not just with plain marijuana or with CBD, we're seeing it with both products now. So it's kind of up in the air as to how it really happens. Like research is still being done to try to really figure out what's going on. but it's something about the molecule either in the marijuana, so it could be the THC part of the marijuana, but there's also a chemical on the CBD products. So it doesn't matter if it's oil or if it's the gummies or anything like that. It's something that's binding to a receptor in our digestive tract, and it is just sending those signals to our brain saying like, get this out of me. It's not supposed to be there. We need to get rid of this. So it's not just specifically with marijuana or specifically with CBD. I know we're seeing it more frequently now, at least in hospitals, because we're seeing it with CBD products and they're becoming more common. You can kind of get CBD products anywhere at this point. You can pretty much go to the gas station down the road and find them. So we're seeing it a little more commonly now, but I don't know what it was like back in the day, like in the 70s and 80s when marijuana was more like used and things
Well,
like that.
it was more common, but there were no CBD products or anything like that, but I don't recall ever hearing about people, going to the hospital or vomiting or having, any issues like that. So it seems a little strange. So can it actually damage your liver and pancreas?
So they look at the liver and the pancreas just to kind of rule out other like issues that may be causing the nausea and vomiting. What you really have to consider with like cannabinoid hyperemesis syndrome is with that vomiting that's kind of severe is you're not getting anything in. So I know I had patients in the hospital, like just thinking of water or like a sip of water would just make them get sick. So you're not getting any water in. So if you're super dehydrated, you can have those other effects that we talked about. So it can cause seizures, it can cause kidney problems because we're not getting any nutrients or sources in our diet.
Okay, thank you.
Yeah, of course.
Jackie, real quick to answer the question that Marlene asked about why didn't we see this in the 60s and 70s? A large part of it has to do with the plants today. Science is remarkable, and the plants today are, from what I have done research on and heard, the plants today are a lot more potent, and that has a lot to do with it versus what was grown in the 60s and 70s. So does anybody else have any other questions for her? Oh, nice.
I feel bad.
Okay,